Good afternoon, everyone, and welcome to the information session for the Baltimore County Opioid Abatement Funds. I want to let everyone know that this is being recorded in order that all applicants can receive the same information. Bear with me one second, we will get started. All right, good afternoon, and again, welcome to the Baltimore County Opioid Abatement Fund Grant Program Information Session. My name is Elise Andrews. I'm the Opioid Strategy Coordinator for the county. And just to remind everyone again, the meeting is being recorded to ensure that all applicants have access to the information session. I would also like to introduce Christina Shoemaker, Management Analyst 2 with the county, who will be managing the fiscal aspects of this program. I know also that Senator Kathy Klausmeyer had signed up to attend and wasn't sure if she was on, but if she is, thank you so much for joining us today. I also want to acknowledge her long-standing dedication to overdose prevention and response. So in this session, I will review the application guidance while displaying the Grant Opportunities website and the application portal. To ensure that we cover all the information, please hold your questions until after the presentation. You may enter questions in the chat as we go, and we will review them after the presentation. Please limit use of the chat function for questions only. At the conclusion of the webinar, you will be prompted to complete a brief survey. I would greatly appreciate if you could take a moment to provide feedback on the information session. And I apologize ahead of time. This is going to be rather dry as we are simply reviewing the guidance for the application process. All right, so hopefully everyone can see the screen share of the grant opportunity page. Christina, can you see it? Great. Okay. As you can see on there, the deadline for all applications is Friday, November 8th at 4 o'clock. Late or incomplete submissions will not be reviewed. The National Opioid Settlement. So the funding for this grant program is made available as a result of the National Opioid Settlement. Baltimore County began receiving funds from the settlement in February of 2023 and is expected to continue to receive funds through 2038. However, final amounts and distribution schedules are still being determined by parties to the various settlements, and not all settlements are completed. Purpose and applicable or eligible applicants. The county opioid abatement funds will be used to remediate harms from the opioid epidemic and address ongoing needs created by the epidemic. In general, proposals should align with Baltimore County's overdose response priorities, align with the approved uses defined in Exhibit E of the National Opioid Settlement, and serve populations in greatest need of restitution due to harms associated with the epidemic. And please don't panic about these documents that I'm referring to. I am going to bring them up, and they are also linked in different places on both the grant opportunity page and the application. Private and nonprofit organizations that serve Baltimore County residents are eligible to apply. It's preferred but not required that applicants have a physical location in Baltimore County. Organizations may submit up to 2 applications. However, please consider this option carefully, as separate applications will compete against each other in the general pool of applications. Funding priorities and specifications. Baltimore County's 2024 overdose response priorities have been compiled from processes that included public input, subject matter expertise, case reviews of fatal overdoses, and interviews with individuals who have lost loved ones to overdose. So you can see here that the document is linked And I also will give you a screenshot of this document. So here you can see that it goes through the different subject areas, such as harm reduction, prevention, treatment, recovery, family support, criminal justice, and stigma, with specifics underneath of there. Then just a reminder that all proposed programs and services must address equity in services. They should all support individuals on medications for opioid use disorder. They have to demonstrate a need based on data and must reference the evidence base for service provision. And again, this document is linked right here. All right. So a sample of priority projects are listed, and the full list of priorities should be referenced prior to proposal development. Alignment with Baltimore County's priorities will be included in the proposal evaluation process. If the proposal is not aligned with one of the county's priority areas, a well-defined description of need should include relevant data to support the need for the proposed project in the county. Sorry, I'm just going to pause and make sure this is recording. Yes, okay. Sorry about that, just want to double check. All right, and we move down to funding specifications. Grant funds will be awarded on a reimbursable basis. However, up to 25% of the annual award may be made available upfront given special circumstances and pre-approval. No match is required. Supplanting, which means using this funding to replace another funding source for an existing program, is not mentioned in the guidance, so I'd like to address it now. Supplanting is not explicitly disallowed by the National Opioid Settlement. However, numerous national organizations and academic institutions have identified non-supplantation as a best practice. Therefore, the county will prioritize proposals that offer supplemental programs and services. This means that funds should not be requested to replace an existing funding source and should not take the place of funding that otherwise would be appropriated for the project. The Network for Public Health Law provides further guidance on this topic, and Maryland statute establishing the Maryland Opioid Restitution Fund includes language indicating that money expended from the fund is supplemental. Christina will drop the links to these resources in the chat if you want to look into that further, and you can always ask questions about that. Please review the general list of allowable expenses and remember that budgets will be reviewed for alignment with project goals. So under funding specifications, one of the bullets goes over just a brief list of allowable expenses. Grant funds may not be used for reimbursable services. Subcontractors are allowed as long as they are aligned with the approved uses and the Baltimore County priorities. If a subcontractor is included in the proposal, their role must be explicitly spelled out in the proposal and a letter of support is required from the subcontractor. Finally, indirect costs may not exceed 10% and cannot be included as both line items and indirect. So as an example here, you can't put something that's generally an indirect cost, overhead types of costs in a generic indirect line item, and then also ask for those expenses as line items in your budget. Okay, time frame for application and award. As I mentioned already, proposals are due Friday, November 8th by 4 p.m. Late or incomplete proposals will not be reviewed. A cross-agency grants evaluation team will review and score all proposals. The Baltimore County Grants Review Committee will also review applications selected for award. Final funding decisions will be made by the county executive. Successful applicants will be awarded 1 year of funding with the opportunity to receive 2 additional years of funding dependent on the grantee meeting timeline benchmarks and achieving progress towards stated goals and performance measures. Submission of accurate and timely reports will also be factored into grant renewal decisions. Applicants should request a minimum of $25,000 and a maximum of $250,000 annually. The initial period of performance will be January 1st, 2025 through December 31st, 2025, again, with the option for 2 additional years of funding dependent on meeting requirements. Next, we're going to move into the how to apply. All community-based organizations must use the online application portal, and you can see here that a PDF of the application is linked. I'm going to go ahead and click on the application if you haven't already seen what this looks like. So please be sure to respond to all required questions and upload all required documents as designated by the red asterisk next to each content area. You will need a project title and project summary, as well as an identified point of contact for the application. Please take note that links and information are contained within the application portal. Please be sure to review the required components for each section, as well as the resources provided. And I'll give you an example here. If you are familiar with a unique entity identifier, you already know what that is and you can simply enter it. If you are not, guidance can be found at sam.gov, the link that's right here in the question. And going further down, you can see, for example, with organizational capacity and structure, which is required, there's a word limit. You also have an opportunity to put an organizational chart, and then the bulleted topics go through what should be included. In the description of need, there's a link to the Maryland Department of Health Overdose Data Portal that can provide data to support the need in your proposal. All right. And again, like I referenced, the priorities document is linked again here in the project description because you're asked to address how the project aligns with those priorities. Keep scrolling through. And goals and performance measures. There's some CDC guidance here on writing SMART goals and objectives. And next is the project budget and budget justification. So I'm going to drag over. If you click on the link there, it will ask you to download this document. You are required to use the template provided and submit it as an Excel document. Please do not make changes to the template except as you may need to add additional line items under Other. Be sure to read the instructions on the first tab, and you can see those are listed right here. There's a set of instructions, and enter all requested information on the project budget and budget justification tabs. Please note that on the project budget tab, you are asked to put budget calculations in the far right column. These calculations should demonstrate how the expense was derived. Earlier on, column E indicates non-opioid abatement funds that directly support the program. If the project receives funding from another source, please include that information in column E, but you do not need to detail the calculations for column E. All right, and then moving to the budget justification tab. That requests an explanation of why each line item is needed. The information here should directly relate to the activities proposed and achievement of timeline benchmarks. For successful applicants, invoice approval will be linked to a final approved budget. Expenditures not included in the budget and approved as a part of the award will not be reimbursed. Okay. Now continuing to move through the application, the next section is the National Opioid Settlement. As I referenced before, alignment with core strategies and approved uses is required. I'm going to skip real quick. These core strategies and approved uses are part of what's called Exhibit E. Let me make this a little bit bigger. This is the document that's included with the National Opioid Settlement, and it goes through Schedule A is core strategies. And then Schedule B is approved uses. This document is also linked. So for core strategies and approved uses, we tried to make it very easy. There's a drop down and you just select which core strategy your project aligns with. And then for approved uses, same thing. There's a drop down and you just select which approved use that your project aligns with. The subcategories for approved uses are a little more tricky. They are a little more wordy. So what you would need to do is figure out which of the approved uses you're aligning with and then list it under each of the approved uses. I'm going to go back. Sorry, I'm flipping around. Just want to make sure everybody can see where this information is coming from. As you can see on Schedule B, approved uses, letter A, this is the approved use. Then listed underneath of that, the numbered items are the subcategories. So for example, let's see, I'm going to go back up. So if you were to choose support people in treatment and recovery, and then you're choosing the first subcategory, you would just enter that into this box right here. We couldn't put all those in. There were way too many to be able to do a drop down. But the core strategy should be easy with the drop down, then the approved use with the drop down, and the subcategory, you'll just need to type that in. And again, Exhibit E, Schedule B is linked right in that section. Please remember that alignment with national settlement core strategies and approved uses is required. Funds will not be awarded for proposals that do not align with the approved uses. And I want to say that again. Funds will not be awarded for proposals that do not align with the national settlement approved uses. This includes clear articulation in the description of need and project description that the proposed project will remediate harms associated with the opioid epidemic. All right, required documents all have links to each document. So you can see here where we're requiring a Baltimore County application for financial assistance. The document is linked right here. The Baltimore County Certificate of Non-Discrimination, it's linked right here. One thing I want to call your attention to is in the Baltimore County application for financial assistance, please make sure that you complete each section of this form, including attaching requested financial statements and listing your board members if applicable. Missing components of this form will delay the approval of your award. Additional documentation, keep scrolling here. Additional documentation such as demonstration of good standing with the Maryland Department of Assessment and Taxation and the Maryland Charities Database are strongly encouraged but not required at the time of application. Successful applicants will be required to be registered and in good standing with the State Department of Assessment and Taxation. Please reach out to our email address, opioidfund@baltimorecountymd.gov, if you anticipate this presents a challenge for your organization. Christina will put that email in the chat. Then finally, on the application, the point of contact must enter their name to certify the content of the application. We've tried to make this, again, pretty simple and straightforward in terms of it will not let you hit the submit button if you are missing required pieces. But just remember that we will not be reviewing late or missing applications. Okay, now we're going to go back and continue on the grants opportunities page. Let's see. All right, uploaded documents should be 12-point font with 1-inch margins and adhere to the word count that are specified in the application portal. Letters of support are welcome but not required unless a subcontractor is specified in the proposal. Any questions regarding the application should be sent to opioidfund@baltimorecountymd.gov, and I think Christina went ahead and put that email in the chat. All right, next is grant review criteria. All proposals will be reviewed and scored based on the same criteria. Please review the list carefully and be sure to include required information and documents in your application. All right, grants management. Successful applicants will be required to complete quarterly programmatic and fiscal reports. Delays in submitting reports will impact reimbursement as well as grant renewal. Acceptance of fiscal reports and approvals of invoices and requests for reimbursement will occur after financial staff review invoices and supporting documentation. The Baltimore County Opioid Abatement Fund is subject to audit by the county and the state. Therefore, adequate invoice backup is required. Annual reports about the fund are also required by the Baltimore County Council, the Maryland Office of Overdose Response, and the directing administrators of the settlement. Successful applicants must comply with the county in preparing these reports. We do not anticipate much beyond the quarterly reports that would be needed to comply with these reporting requirements, but on occasion we may need additional information, and we'll look for successful grantees to help support the county in answering those requests for reporting information. Grant monitoring during the first 6 months or as compelled by performance may include more frequent requests for funds expended and updates to progress on timeline benchmarks in order to ensure effective and timely project implementation. All proposals should be based on realistic and achievable service provision. Again, there's another opportunity here. Questions should be directed to the Opioid Fund at baltimorecountymd.gov. Successful applicants will have the opportunity to request technical assistance on topics related to the grant fund and content regarding overdose response. Requests for technical assistance will be addressed on a first-come, first-served basis and may be limited by resources available. Resources and best practices. Please feel free to use this list of resources to document need and justify proposed activities as best practice. The National Opioid Settlement clearly references the preference for evidence-based and evidence-informed programs or strategies. Documents in this list of resources and/or peer-reviewed literature should be referenced in each proposal to demonstrate that proposed activities are aligned with the evidence base. All right, so one other thing, you probably noticed in the application that there is a requirement to document goals and performance measures. And I just wanted to spend a second to share with you that the Baltimore County Overdose Prevention Team will be discussing strategies for developing program performance measures at this Friday's monthly meeting. The County Overdose Prevention Team meets monthly on Friday, the third Friday of each month from 8:30 to 10. And we have been working steadily to develop an action plan related to recommendations that come from our drug overdose lethality review team, which reviews about 3 cases a month and makes recommendations based on those case reviews. The Baltimore County overdose response priorities referenced in this application are aligned with the lethality review team recommendations. Therefore, anyone interested in applying for county opioid funds is invited to join the meeting and discussion this Friday. Our contracted evaluator for the county's overdose data to action project will be present and will share outputs and outcomes that allow the county to compare efforts and outcomes with other jurisdictions in Maryland and across the county. So if you are looking for some more insight about program goals and performance measures, we will be talking about that this Friday. If you would like to join that meeting, either just for this Friday or on a regular basis, you can email Brandy Miller at bmiller@baltimorecountymd.gov to receive the meeting link. Christina will also put Brandy's email in the chat. Okay, at this point, I am going to stop sharing and move on to questions. So if you'll bear with me, I have not been able to see the chat, and I am going to pop that out and make it a little bigger, and we'll go through questions in the chat, and then we'll go on and let people unmute. I see a question here about, can you save and finish later, or do you have to enter everything and submit in one setting? That is a great question, and we will have to put that out in the FAQs. One of the things I had hoped to do before today is to submit or go ahead and enter a sample application, and I just did not have time to do that. So we will have to follow up on that one. All right, the next question in the chat is, can something fall under more than one category? So I'm assuming this is in relation to the core strategies and approved uses of the National Opioid Settlement. And for those, you have to choose one core strategy and one approved use as your primary. If you want to identify, there's an option in the application where you can put any additional information to help support the review of your proposal. If you want to identify that you're meeting more than one core strategy or more than one approved use, you can put that information in there. But as a part of the application process, you have to select one core strategy and one approved use. Is it required that the board of directors approve the application? What is required in the application is that the point of contact sign off that everything is, that you confirm all the content of the application. And I'm going to have to scroll up here real quick and look at the application for financial assistance. I believe that, sorry, it's taken me a second to pull that up. I don't want to answer this incorrectly. So that requires an applicant's signature that certifies that the information supplied in the application is correct. So I think that's really an internal process within your own agency. If the board of directors has to approve it, you have to make sure that your point of contact is has the authority to sign off as a point of contact and also has the authority to be the applicant's signatory on the application for financial assistance to the county. Are there any audit requirements? So the audit requirements are going to be coming as a part of county government, that the fund is governed by the county. We don't have any explicit audit requirements right now for successful applicants. One of the challenges with this funding is that because it's still being rolled out in certain aspects, we are still receiving details about how to report what we've received and what we've spent. So all I can tell you is at this time, there are no audit requirements as a part of the Baltimore County Abatement Fund. But where that gets a little challenging is that the county will audit the funds. So as a successful grantee, you will have to make sure that you have submitted all the appropriate backup documentation, and in certain cases could be asked for additional information to support the expenses that you've reported. All right, where will we find answers to FAQs? So based on questions that were asked in this session and any additional ones that are sent to the opioid fund email by the end of this week, an FAQ document will be developed and released next week. It'll be sent to everyone who signed up for this information session and everyone who sends questions to the opioid fund email. Is there an estimated time that the awards will be received if granted? So the estimated period of performance for the first year is January 1st, 2025 through December 31st, 2025. There's a somewhat of a tight timeline in terms of submitting proposals, getting them reviewed and approved, but the goal is to allow for successful applicants to begin spending funds as of January 1st, 2025. Certainly anyone who is in this information session can feel free to share the links about the grant opportunity and the application. We will also make this recording available and attach it to the grant opportunity page, and you're welcome to share that with anyone in your organization or anyone who you believe would be eligible for this funding. How many awards are you expecting to make? We do not have a stated number of awards. We have a target amount that we're looking to spend in these first 3 years of this grant opportunity. However, as I mentioned previously, We do not have a full schedule of all the distributions that are coming to the county. We do not have a total amount of money that is coming to the county. In addition, you may have heard most recently, there's a settlement with Kroger. We just signed on to that settlement and we do not have any amounts associated with that settlement. So we have targets that we're looking to reach in terms of how much money we're trying to get into the community. But unfortunately, because of the nature of the national opioid settlement and how the information is conveyed to the county, we do not have all the information to exactly plan out each year how much money we can spend because we don't have those total figures. And you did hear correctly that we are going to be receiving money through 2038. This particular funding opportunity is approved under the current administration for an initial period with 2 renewal years. And that's really all I can speak to right now. Okay, what would be a case to need a board of directors? Is that site dependent or project dependent? Again, going back to the application, the Baltimore County application for financial assistance, if your organization has a board of directors, you have to include that information in the application for financial assistance. All right, so how does the county funding correspond with the state funding? Will an agency only be granted one of the 2 funding sources? So these 2 funding sources are independent. The State Department of Health closed their application process for opioid restitution funds, I believe, at the end of July, and I am not aware that decisions have yet gone out to applicants. There's no requirement that if you receive funding from the state opioid restitution fund that you cannot apply to the county fund. And I know there are several interested parties in this information session who did submit applications and don't know the status of that. You can submit an application for county funds and would just be required, you know, again, as what you certify to on the application for financial assistance. If you end up receiving those funds from the state, you would have to withdraw your application from the county because we're not going to double fund that. And we do have I believe we do have one participant in the information session from the State Office of Overdose Response. We also have close connections with the Maryland Department of Health. So we're gonna know who was funded through that. Not that we think anyone would try to get funding from both sources for the same exact project, but you can submit the same application if you would like to the county funding. All right. Is board of director required in an application because we are considered a small organization? Again, if your agency has a board of directors, that information needs to be shared on the application for financial assistance. If you don't have a board of directors, then that, you don't have to answer that question. Is data that is tracked from the grant funds shared with specific entities? That's an excellent question. So one of the requirements with this funding, and this really comes from both the advocacy community, the academic institutions who have been involved in overdose response and best practice, is that the opioid abatement funds be accountable and transparent. So as a county, we are committed to being accountable for the money that we spend and transparent with it. And that really translates to grantees who have stated goals and performance measures and share data back with the county that we can then share with the community in terms of what is being accomplished with the funding. And then transparency, again, how much money are we putting out into the community and how is that money being used? So in terms of specific entities, there are some state reporting requirements. There are also reporting requirements with county council. We have to submit a report annually to them. So that kind of data would be shared with those entities. The grant opportunities page that I just walked you through is eventually going to be expanded to demonstrate what organizations received awards and what their projects are, and then eventually outcomes from the projects. So that's where data could be shared with the state, with county council, and then with the public in terms of performance measures and stated goals from each proposal. Is the Baltimore County Health Department eligible under this grant? So another excellent question. So this grant opportunity is designed kind of with two parallel processes. The online application is for community-based organizations. Then there is a parallel grant opportunity or application process for county agencies interested in this funding. We had to separate them out because we couldn't use the application process and distinguish between who's required to submit what information. For example, county agencies do not have to submit an application for financial assistance because they're county agencies. The parallel process is that we want all of the proposals to be submitted at one time. So county agencies must meet the November 8th deadline. And then we have a cross-agency grants review team that also includes state representation and academic institution representation. And the scoring will be handled in such a way that no one will score their own proposal. And different groups of proposals will be scored by different groups within the grants evaluation team. Okay. Can you send attendees a copy of the Baltimore County's 2024 overdose response priorities? The link on the website is not working. We can put another link in the FAQs. I would encourage you to go into the application. Let me see. Okay, I think what the link requires you to do is to download it. So it's not going to take you to the document. It's going to ask you to download it and save it. So I would suggest trying that. There's also another link for it on the in the application portal that would work the same way. And then we can include it with the FAQs. Is nonprofit organizations eligible? Yes, private and not-for-profit organizations are eligible for this funding. Okay, assuming an applicant is awarded in 2024 for a 2-year project, would they be eligible to apply for a new project in 2025? No determination has been made about future grant cycles, so I can't really answer that question at this time. And just to be clear, the initial period of performance is going to be January 1st, 2025 through December 31st, 2025. And the award is for 1 year with the opportunity to renew for an additional 2 years based on performance. You and I are on top of each other. Is this the first cycle of opioid settlement funds released by Baltimore County? Yes, we are anticipating additional grant opportunities. We don't have that laid out. Again, we don't have final amounts from all of the settlements, and we don't have final schedules of the payments to the county. Can the application due date be extended at all? I am sorry, but it cannot. We are on a tight timeline to try to get the funding out by January 1st, so it can be projects can be started at that time, so we cannot extend the deadline at all. So at this point, I went through all the questions in the chat. If individuals have additional questions, I would ask you to raise your hand or go ahead and unmute and you can ask your question. We have about 20 minutes. We can entertain more questions.
Elise, there's another question in the chat.
Okay. All right. Can you please repeat the guidance on supplanting? Okay. You'll bear with me. Let me go back. And again, I would refer you to the links that Christina put in the chat from the Network for Public Health Law and links to the Maryland Opioid Restitution Fund. But I'll read my statement again. Supplanting, which means using this funding to replace another funding source for an existing program, is not mentioned in the guidance that's on the Grant Opportunities website. Supplanting is not explicitly disallowed by the National Opioid Settlement. However, numerous national organizations and academic institutions have identified non-supplantation as a best practice. Therefore, the county will prioritize proposals that offer supplemental programs and services. This means that funds should not be requested to replace an existing funding source and should not take the place of funding that otherwise would be appropriated for the project. The Network for Public Health Law provides further guidance on this topic, and the Maryland statute establishing the Maryland Opioid Restitution Fund includes language indicating that money expended from the fund is supplemental. So I know that's potentially clear as mud, but that's, we're taking guidance from national organizations and best practice, and that's really what we want to make sure we comply with. Okay. All right, I see a couple other questions. Can an organization include in the request a grant writer fee? It is my understanding that that does not fall under approved uses from the National Opioid Settlement. So at this time, I would say no. Will proposals with more matching support in their budget be viewed more favorably than those without? Let me scroll back to our grant evaluation criteria. So there, in terms of the grant review criteria, we address reasonable timeline, budget, and spending plan. So matching support is not explicitly being scored higher. However, that is considered part of the spending plan. So it will be taken into consideration when the grants are reviewed. The recording of this, hopefully, either by tomorrow or Friday, we will be able to attach it to the grant opportunities. And then early next week, we should have an FAQ document out. All right, any other questions to drop into the chat, or if you'd like to unmute yourself, which I think is a possibility, just want to make sure. All right, I see some thanks. You all are very welcome. It's my pleasure to be here and hopefully help to explain it. If you think of further questions after this, again, please use the opioid fund at baltimorecountymd.gov. That's where you can also, if you encounter any technical issues or have questions about the application, Christina and I will be monitoring that on a daily basis. We probably will not respond individually, but we'll include questions in the FAQ as we receive them. All right, I don't see any other questions in the chat. Okay, one more. The meeting on Friday, will that be a repeat of this or more info? So that will not be a repeat of this. That is somewhat supplementary in terms of the opioid the overdose prevention team has been working on an action plan, and part of that is the development of performance measures. So it's an opportunity if you kind of wanted to see where that group is going with performance measures and maybe get some hints or ideas as to what you want to include in your proposal. Everyone, it's an open meeting. Anyone and everyone are welcome to join us. We do other work around overdose response and networking. So I would invite you to join us, and if you get something out of the performance measure part, then we'll all be better off for it. So the same question coming up again, can we come back to the application or does it have to be filled in at one setting? That's something I need to work with our IT department and figure out what happens with that, and we will address that in the FAQs. All right, just checking. Any other questions to drop in the chat or unmute yourself. All right, if nobody has any other questions, and thank you, Christina. She just put the opioid fund email in the chat and also Brandy Miller's contact. And Brandy is the one you should reach out to if you would like to receive the link for Friday's overdose prevention team meeting. I appreciate everyone coming and listening in. We look forward to proposals and getting this funding out on the streets and working together. So thank you all very much. Again, if you have any additional questions, please send an email to opioidfund@baltimorecounty.md.gov. And have a good afternoon.